Long days, long and nights. You feel? Now, I don't even know lately.
What's up, guys? Welcome to I Am Doctor. I am your host, Dr. Antonio Webb.
And I'm your co-host, Dr. Maita.
All right, today we're going to be talking about everything that we wish we would have known before we became doctors. And we're going to work out today. What are we going to work out on?
And we're also going to tell you what they didn't tell you about being a doctor.
All right.
We're going to do some sprints up here, and we're going to go do a quick little outside workout, hit some circuits. All right, let's start.
Put them in the dirt, say it again, man, and that's a reverse. Never rehearse, jumping in first. Call up the nurse, put the beat in the hearse. This is absurd, take the berserk. Don't get on the tracks, man, and they better swerve. Don't got a nerve, man, I never curse. Just casting these spells when I'm spelling these words. That's real, that's too real. I've been Mostafa, I need a new deal.
Feeling good, how about you?
Good. A little warm up.
All right, we're going to walk over to the circuits over here. It's like a pull-up bar out here. Dip bar. Yeah, bro, we don't need any injuries, man.
So how you feel, man?
I'm feeling good, man.
So what are we going to work on today?
We're gonna do some pull-ups. You down to have a pull-up contest?
We can do that. You sure you want to do that?
Oh, I'm ready. Then we're gonna do some dips. Gonna do some ab work. And hit some of those battle ropes again.
All right, let's do it, man.
All right, we just finished up the sprint. Let's go ahead and hit the circuit workout. You had a good week, though?
Yeah, man, it's good, man. It's busy. You know, getting everything.
That's one thing I didn't know. Always gonna be busy.
Always,
right?
Man. That's all. It never ends. All right, what we got, man?
We're gonna start with some pull-ups right here.
We doing a pull-up contest or what?
Yeah, let's do a pull-up contest.
All right. I'll let you go first. Anesthesia is up first. Ortho's gonna come behind. Oh crap! Here we go. I can't even do that many. Shh. You counting that? How many is that?
I'm gonna just do like
Come on, bro.
I just did 8. You know, we gotta
Just
take
8?
it easy on you guys.
Just 8?
Before you guys say it's Anesthesia's fault. Yo, so you just started practice. Are you enjoying any of the money right now? Because I'm ready to start enjoying some of that.
Not really, man. So that's one of the things that I wish I would have known.
Yeah.
Is that, especially if you want to be real frugal and be really aggressive with your student loans, I mean, you have to live like a resident those first few years out of practice.
Yeah.
So I would say nothing's really changed for me. That's what I would suggest for you also, man. Let's go.
I'm going easy on you, bro.
All right, here we go. What about you, man? You looking forward to being done?
Yeah, I am. You know, one thing I didn't know is you gotta have a good plan to repay your loans and be frugal after residency.
Yeah.
And like one thing is like, you know, your whole family's waiting for you to make all this money and they think that you're just walking around with bags of money. The reality is you still gotta lay low a little bit.
They already think that, man. As soon as you become a doctor. As soon as you graduate medical school.
Yeah.
Everybody thinks you have all this money.
Well, I'm originally from Lebanon.
Yeah.
And so my whole family there just thinks like, this guy's got mad cash because he's in med school and finishing up med school.
Yeah. That's one of the things that, it's a big misconception. Because even when you're done with all your training, man, you got a lot of people holding their hand out. You know, student loans, Uncle Sam.
Yeah.
You got your family that's been waiting for 10 years. Like,
Uncle Sam!
You still in school, you finished training, so you got a lot of people that are going to be holding their hands out.
Let's go.
Got one more set?
Yeah. Yeah, I would have paid more attention to tuition costs. I didn't even look at that. I was just like, yo, I'm trying to get in. I don't care how much I have to pay. But in hindsight, I would have paid more attention to that because it adds up fast.
Oh, absolutely, man. The average med student comes out $250,000, which is crazy.
Yeah.
If you would have paid attention to that, what specifically would you have done differently?
You know, that's a good question. I would have applied to more schools, and I would have made myself a more competitive applicant to go to like a cheaper school. You know, but it's crazy. Like, I didn't even know back then that I couldn't apply to Texas schools because I'm originally from Arizona. So, but Texas schools are a lot cheaper, man. It's nice.
Yeah, absolutely. But you do got some people though that may not have
Do some dips.
other opportunities, other acceptances.
Yeah.
So they may only get accepted to one school, like me.
Huh.
So I really didn't have a choice.
Yeah.
Georgetown is $100,000 per year for medical school.
Yeah.
Which is crazy.
But it comes with the name. You know, it's a good name.
But I don't think the name is that important, man.
Yeah.
I think your name of your residency program, fellowship program, you can go to Joe Blow Medical School, make all A's,
Yeah, it sounds
do really
like a
well
nice
in your
school.
step one, and then go to Harvard for your fellowship and still say you're Harvard trained.
Yeah.
A lot of people really don't know that.
Yeah.
What are your thoughts? You think the name of the school matters?
So I went to an osteopathic school, and you know, I feel like I had good training there, and it set me up for residency. But like you said, the most important thing is residency and fellowship if you decide to go into it.
Yeah, absolutely.
Yeah.
So what are some other things about anesthesia that you wish you would have known before going into it?
You know, one thing with anesthesia is, I told you before that at the end of the day, you don't work on your own time. You work on the surgeon's time.
Yeah.
You're on his clock. So, or her clock, right? So, you know, that kind of caught me by surprise.
Yeah. Yes. You know, for orthopedics, especially for surgery, one thing I didn't realize is that, and I'm finally seeing this out in practice, is that you're always on call. Even if you're not on call. Any patient that I've operated on, any patient that I've seen, they can call or show up to the emergency room.
Yeah.
They're going to call me because I'm that patient's doctor.
Yeah.
Which is something I really didn't realize until I was out of practice.
Yeah.
And you know, if you're in anesthesia, I don't know if you feel that same way. What are your thoughts?
Well, in anesthesia, I mean, you just do perioperative work. So you don't take any notes home. You don't have to come home and come in the morning and round. That's what I liked about it. And eventually I can go into chronic pain, help you guys out with your patients that suffer from chronic pain. But another thing I want to talk about before I forget is like, dude, it was so competitive in undergrad.
Yeah.
Did you feel like that?
Yeah. I mean, you do got people that are gunners.
Because you got all these gunners trying to get in med school.
Yeah.
And, you know, half the time can't trust what anyone says.
Yeah.
They're trying to set you up.
Yeah. I think medical school is more competitive than college, though.
But it depends what kind of med school you go to.
Yeah. And then plus, you know, the schools that are not on the pass-fail, or if they are like a high-pass honors, I think those schools are even more competitive because everyone's trying to get honors or a high pass. But if you go to a school that's just pass-fail, no one really cares.
Yeah.
I think schools should go to a pass-fail.
Was your school pass-fail?
Honors, high honors, pass, low pass.
Mine was like a grade system.
Yeah. How did you do in med school?
I was like, you know, in the middle.
Yeah.
Because my first year, it was a big learning curve for me. Because I was out for like 3 years. I was out of school. But I did much better during my second year. And during second year, that's what really counts. Because you're getting ready for your steps and stuff like that.
Yeah. I mean, the people in med school, man, if you think about people in college, you got some people there that are smart. Some other people are there because their parents make them. They're not really smart,
that's
bro.
True.
In med school, everybody's freaking smart.
Yeah.
So it makes it really competitive.
Yeah, my dad was just like, dude, just go into finance. Why are you doing all this?
Yeah.
And I was like, no, this is what I want to do.
Anybody in your family's a doctor?
No one in my family's a doctor. The only doctor I have, the only doctor we have in the family is an uncle of mine in Lebanon. He's the only one. He's a primary care physician, super smart, but no one else really.
Would you ever go back to Lebanon and practice?
To practice there, man, that's tough because everything's different there. Probably move slower. I don't know, man.
Yeah.
Would you go to Lebanon and practice?
Never been before, bro. When are we going?
I know they'd love you out there, bro. We need spine surgeons.
Let's go, man. Set up a trip. You do the anesthesia.
I wanted to ask you earlier, what's that 444 on your shirt right there?
Don't worry about that, bro. Nah, it's a movement, man.
What movement?
No, so this is something that it keeps me focused, man. So the people that are successful, man, they do things that other people aren't willing to do. And so what I have done the last few months, man, I wake up early in the morning, usually at 4:44 every morning. That basically motivates me, man.
Dang. Really?
Yeah, it's hard, but I think it's a lot easier if you keep doing something that, it becomes easier over time. So I don't want to wake up every morning at the same time at 4 o'clock in the morning, but
You got to do 444 reps
let's do it, man.
with this movement right here. There you go. Yes. Killing it, bro. You're killing it.
So what time do you wake up in the morning?
Well, I just sleep in every day. What are you talking about?
Sleep in and work out?
Yeah, that's it.
That's it?
Work out, eat, and just occasionally go to work.
What about the work hours, man? Is that something that you kind of knew, kind of getting into this?
No, I didn't. Because I didn't know I wanted to go into anesthesia. An anesthesia residency, I don't think it's the easiest residency. I think afterwards it gets better.
Yeah.
But especially if you're doing trauma, it can get a little rough.
How many hours do you work a week?
Now, not that much. During my last year, not that much, like maybe 45, 50.
What about as a second year, first year?
As a second year, you're working on average like 70. On some hard weeks, depending on how many idiots are stabbing, shooting, or running into each other that night, you know how it is.
Yeah.
You might work like up to 80.
Okay. Yeah, it's the same thing, in surgery. Some rotations are busier than others, but I didn't know that it would require so many hours, man. Even outside of work, you got to prepare for cases, you got to read, you got to study, in addition to your normal job as a resident.
Yeah, so that's the other part is I used to hear like estimations of hours,
Yeah.
but people didn't consider like the hours you put in while you're studying too.
Yeah. And that's another thing, is studying, man.
It doesn't stop.
It feels weird now, being done with all my training. I feel like I should be studying it at times when I'm just sitting around the house or, just lollygagging around. I had that thought in my head, like, man, I should be doing something right now.
Yeah.
I can't get over that.
Yeah, so whenever I have free time, like by default, I just try to study if I have free time. There you go, bro. 422 left.
How many hours? How many hours a week do you study now?
Now?
Yeah. As a resident.
On average, I'll try to put in like an hour a day.
Even working 70 hours a week?
Well, now I don't work 70 hours. But like on average, I'd say an hour or two a day. But during second year, I would study even more because you're learning a lot back then.
Do you guys have tests every year?
Yeah. Do you guys?
Yeah. What's it called?
Like board exams and stuff?
Yeah.
Yeah.
What's the name of it?
The name of ours, the basic exam, so tests on the basic fundamentals of anesthesia.
Then what happens if you don't pass it?
And you retake it. It doesn't look as good on your CV. That's it, really.
Yeah.
I've known people that still got jobs. I mean, they failed it a couple times and then passed and they get jobs.
Yeah, I mean, that's one thing I didn't know is that even after graduating medical school, you got a lot of tests you have to take.
Yeah.
Every year, as a ortho resident, you're going to take a 9-hour exam.
Hey.
And you have to do well on the exam.
And it's not just written tests. It's like oral board exams. So you got like a attending doctor like you quizzing a resident, right?
Yeah.
Those can be stressful.
Yeah.
And it's not the way that you're trained to study, right?
Yeah.
So you got to take sometimes special classes for that, or you have mentors in your residency program who will train you.
Yeah.
Like at my residency program, we have 5 or 6 oral board examiners. So they train you to pass that test.
Wow.
So it's good. Yeah.
Yeah. So, coming out of med school, what's that?
Like I never thought about this stuff.
Never. We even have lectures as residents, weekly lectures where we have professors who teach us certain things, go over certain topics. I didn't know that. Mm-hmm. We still, it's basically like going to class on Friday mornings.
This might sound naive, but I thought like once you're a doctor, like that's it, like you're good. It does not stop. So you guys got to study forever. It doesn't stop.
It doesn't.
But it's good because at the end of the day, it's all for the patient care. And the better you are, the more knowledge you have, better you can take care of people.
Yeah. Even being in private practice, I still review research articles. I still...
yeah, I saw you the other day.
I still, study for certain cases, review my anatomy. It like you said, it never ends.
Yeah.
You have to, as a pre-med student or a college student, you have to see how you study best, develop like really good study habits, study strategies, because those things are going to stick with you throughout your training.
Yep.
All right, we hitting the abs now?
Yeah.
Why'd you have to climb up on the pole to get up there, bro?
You were the master at that. You kind of gave me a few lessons before we came here.
All right, cool. How many are we doing?
I don't know, bro. This competition, I think I already won. There you go. Just hit 10 real quick.
So what would you say to that med student out there that has doubts about becoming a doctor? Or that pre-med student?
It depends what their doubts are, but I would say, first of all, don't do it if you're doing it for someone else. Like, you're not gonna make it, bro. You might make it into like med school, but you're gonna drop out or something.
Yeah.
You're gonna get sick of it.
What about doing it for money?
Absolutely not. There's a lot of ways to make money.
Doctors make a lot of
Bro,
money.
I'm still negative, man. I'm in my early 30s.
Yeah, I mean, you see a lot of people when they want to become doctors just because how much money they think doctors make, but
How much do doctors make?
it depends. Your specialty, how many years you are in practice, private practice versus academic. I mean, the specialists, on average, they make more than kind of the non-specialists, but I mean, for a specialist, I don't know, private practice, average 400, 500,000.
Yeah.
But I definitely wouldn't do it for the money.
Yeah, no.
It's not worth it. I would go into another field.
Well, you got to think about it too. There's opportunity costs too, right? Because all that time you're spending studying, you could be spending that time becoming an expert in something else and making money that way. So
Yeah, absolutely.
don't do it for the money. Do it for the fame and the cars and the glamour, bro. That's what it's about. What do you think, man? Is it about that?
What's that?
The fame, the car, the Lambo that you pulled up in today?
Man, I wish it was that easy, man. But, even when you're done with all your training, like I said, man, you got people coming at you. Malpractice insurance, disability insurance, health insurance.
Yeah, I never thought about that.
If you're private practice, you got to pay for all that stuff.
Yeah,
I mean, these are expenses, but at the same time, man, it adds up.
Yeah. For sure, man.
After hearing the number that typical doctors make, around 400, 500,000, do you think that kind of levels out the fact that the interest rates are so high for the student loans?
It just depends on how aggressive you want to be paying back your loans. Me, I'm kind of on the extreme. I would probably say 99% of people are probably not going to be as extreme as I.
Like what, with loan repayment?
Yeah, with loan repayment and not like blowing through your salary. For a lot of people, man, once you're done with your training, it's kind of like that rookie in the NBA or NFL gets that first bonus paycheck.
Yeah.
I mean, you're going from making what $3,000 a month as a resident, getting a check for $75,000 every month.
Yeah.
So for a lot of people, man, it's like, I've been in training for 10 years. I'm going to go buy me a Bentley.
Yeah.
Buy me a Porsche.
A lot of people do that, and then they get stuck in the rat race, though.
Yeah. But that's kind of for a majority of people. But I would say I'm on the extreme kind of line of that. Be very aggressive
With your loan repayment.
loan
being
repayment,
frugal
as
and all
well
that.
as not touching any of the money that I
I'll tell you what, like, I know he quoted some numbers, but there's a lot of specialists who don't make that much. Like, if you're primary care, pediatrics, you're making like around 200, plus or minus a few $10,000. So not every doctor makes that much. The more you're subspecialized, the more earning opportunity you have. I will tell you this though, and I've talked about this to my friends, like, there's no number you could put on how much doctors make. And I'll tell you why, because we deal with some crazy stuff. Like, I never knew, like, it might be naive, but I never knew I was going to see people die in front of me, and be taking care of someone. And, like, at the very last moment of, their death.
How many people have you seen die?
I want to say probably like 10.
Well,
the other day in the OR, someone died. I was taking care of them. They got in a car accident. They were bleeding. Had the intracerebral hemorrhage.
How do you deal with that as a doctor?
It's hard. There's no like training or anything, and it leads to burnout. It leads to physician depression. I mean, that's what I mean. Like, you could give a doctor $200,000, $500,000, but to deal with that is extremely difficult, and you can't cover it up with a paycheck, right?
Yeah, absolutely, man. It actually it's not about how much money you make as a physician or a surgeon.
Yeah,
you can make $1 million, but if you blow through that money, it doesn't matter.
Yeah,
a pediatrician who makes, let's say, $150,000 a year, you can certainly become a millionaire, man. You got to know what you do with your money. Invest, appropriately, and be very frugal coming out of training. Yeah, certainly. It's not about how much money you earn. It's about how much money you keep.
And it goes back to what I said, man. Like, if you're going into it for the money, you're going to deal with some situations that no money is going to make you happy. You're going to have some call nights where you don't see your family. Yeah. You're going to be on the night float system where you don't see your family for 2 weeks at a time. So no amount of money is going to put a Band-Aid over what you're going to see and experience.
Oh, absolutely. It's not, man, because, those times where you're not seeing your family for a few days, it's one of those things that, it's one of those, you got to make sacrifices. I mean, if you're not willing to put in and sacrifice, man, your half of your life to become a physician, I would say don't do it.
Yeah. And I like to work out, bro. I didn't know I had to work out mad fast during residency and med school and just be in and out and time a lot of things. When you're studying hard for like your steps, like you got to time everything.
Yeah.
Like, I mean, at least I did. Like, I'm going to have lunch right here. And then this day I finished my exam, so I'm going to go visit my family for 2 hours and come back and study.
Yeah.
Like, your life kind of moves in fast forward, especially when you're in the first 2 years of med school.
Yeah. So, thinking back to your pre-med years, what would you tell your pre-med self?
Bro, I was never a pre-med, bro. I just made it, dude.
Okay.
No, I'm just kidding. What? Just be ready to make a lot of sacrifices. Don't think so much about the money. And just look at the long run of how you're there to serve patients. That's what it's about.
Yeah, and I would say always remember your why. You got to remember like why you chose this path, why you want to do this. This is not a typical lifestyle, or this is for the atypical. Nothing about your life is going to be typical as a doctor.
Yeah.
So.
And another thing is you have people in your life like during pre-med, college, whatever, but a lot of those people are going to start disappearing.
Yeah.
And the ride or dies are going to stay, right? And so I never realized that was going to happen, but it's inevitable. You're going to be busy, you're going to lose people in your life, and you're going to keep some people around.
Yeah, All right, man. Is that it for the workout?
Yeah, I think that's it, man.
Great workout.
Good workout, man. Do it again.
Absolutely.
You have a good one.